So this is Albert, and today we're doing his 2-day composite bonding course. And of course, we're going to learn a lot about composite bonding, but we actually have a second agenda.
So we're going to be talking about what courses you should be going on, whether you should be going on courses at all, and all our tips and tricks from all the courses that we've been on. And we're going to be asking the delegates questions like,
what courses do you like for your associates to go on? Just wanted to ask you why you chose to come onto a composite bonding course.
What are the top 3 course topics that you would recommend to young dentists or someone starting out?
So let's get into it.
So I think obviously we've done a lot of courses and we started doing them in FD. So in foundation training we started doing some courses, but truthfully we were quite lucky because both of us were living at home, isn't it?
Yeah, and I think it made it a lot more affordable. It meant that we could go on all the courses that we did want to go on because we didn't have to pay rent, we didn't have as many expenses.
So I think the first thing to think about is, can I afford to do some courses? If you're a younger dentist, you're in your foundation training or you're a student, then maybe you should look into getting some learning through online videos. There's lots of YouTube channels, resources. So start there and then think about, what courses can I purchase, or what things have I learned online, what things am I not able to learn online that I need to get some hands-on experience on, maybe like composite bonding, and then go and do the course. Angulation, guys. This is why you need loops. This is it.
It's true.
Yeah, so we're halfway through.
What the flip?
Bro, what happened?
Came up with the band. The cured up.
The composite.
Yeah.
No, he warned about that. You didn't polish it into proximally. You were rough in it. Well, anyways, I just wanted to say we're halfway through our a little bit of hands-on. Can we just appreciate the handbook? If your course doesn't have a handbook like this, what are you doing?
Unreal, right?
Has got to be by far the best handbook we've had on any course. Has all the slides, all
the
these
steps.
pictures, all these steps. Just great. And the reason these handbooks happen are sick because sometimes when you're in a course, you can be so bogged up in writing and making notes because you want to retain all this information, right? We don't have the best memories, we can't remember everything. But just knowing that everything is in the handbook,
Puts you at ease.
It puts you at ease. You can just kind of flick through the handbook whilst you're doing it as well, and really kind of absorb the information. So many times I'm writing notes, and then as I'm writing, I miss what the speaker is saying.
Or you don't see what they're
You
doing.
don't see what they're doing, because you're trying to do it at the same time. So, rate the handbook. So guys, we're with Albert now, the boss, and it's at lunchtime, so we had some really nice food. But we wanted to ask you, Albert, in this video, we're kind of discussing should you do courses, what age, what point in your career, and which courses to prioritize. What's your kind of opinion on that topic? The young dentists, they're so keen to do courses nowadays. What do you think?
Yeah, to be honest, I didn't think there's for many courses, I don't think there's the right time to do a specific course. I think it is vital that you start doing courses early, and I think the importance there is that you're going to experience new things, right? So new techniques, the sort of possibilities to new fields of dentistry, and if anything, you're going to get a taste for that particular area of dentistry.
Yeah.
So I think that's a good kind of way to start, and maybe don't book kind of a year-long course to begin with.
Yeah. So short courses, maybe.
Just start with a short course, and if you really enjoy that topic, if you like that topic, you can always take up further education there, right? So I didn't think there's particularly a correct time. But with that said, I think the most important thing out of courses is that you use the material that you learn and use it right away. Okay, so similar to I think what we discussed before. Obviously, it was off camera, but where I was back in my NHS days, and I was doing a lot of work free, right? So I've learned some new techniques, and I was just to try them on my patients, and I wanted to practice them, to learn them, and I think that is the most important thing. Even if it might not be the place that will, pay you for those things, I think that's important.
Yeah.
Really get in and
do them for free, even if you have to, basically, as a learning time.
Or cost price, or you could. When there's a will, there's a way, right? That's the saying, and I think that rings true for the true.
What does make you a pro? What makes you so good at composite bonding? How have you developed that?
Well, I wouldn't say I'm a pro. Defined as
I beg to differ.
but
seen
that's
it work.
very kind of you guys.
Oh my god. Well, what have you done to get so good?
Is it the experience? Is it the number of times you've done something?
It's practice. It's practice. So the way I think about courses, especially if it's like a short course, it's kind of like your driving license. And so you're learning to drive a car, and you get your license, and that's great. So now you're safe to go out and drive a car. If it doesn't make you a great driver,
True.
Okay, and we'll all have different sort of levels of skill, right? But it gives you everything you need to be safe and to get your first case out, right? First case under your belt, and then once you get that, it's just an endless game. It's just practice. Don't stop learning. I think like you've got to go and push yourself. You do more courses and and pick up those new things, and implement it straight away. So I think it's just practice. Well, practice is what is ultimately
100%.
Practice as much as you can, guys. Get some tooth models and do some composite bonding on tooth models. Thank you so much,
that's
Albert.
massive. Yeah, that helps.
Thank you so much.
Thank you so much, Albert. Look
Really
forward to the
enjoyed the
afternoon.
course. That's it. So we've done 3 teeth today. The central we built up with a sectional matrix, or the interproximal. The lateral we kind of did freehand. We just built it through using a flat plastic, and then finally the canine we built using the mylar pull-through technique.
Biggest game changer for me was just like the polishing routine, isn't it? Like,
It's just made it so simple.
so simplified. The burrs, like in certain areas you use the burrs, in certain areas you use the discs. Whereas I know like some other people recommend like going through the polishing disc, like coarse, then medium, then fine, then extra fine, and like there's a lot of different steps, which works really well.
It's got beautiful shine to it.
But this, I believe we've achieved a fantastic shine with just using 3 things, which is the burr, the disc, and the spiral polishers.
Either the ASAP or the EV.
EV polishers. Yeah. It looks really
rubber
good.
discs.
Yeah. So day 2 now, and wanted to stop and kind of give you guys another tip on the train. And another thing is, when you're deciding for a course to go on, I think it's quite nice to have done that procedure a few times before, if possible. So, for example, instead of just going on a composite bonding course when you've never, ever done any composite bonding, I think it's nice to have done 1 or 2 cases, even more if you can, maybe single incisors, or like 2 to 2. Or 2 teeth even if you can, so that basically, camera's going, so you can learn from your mistakes. So when you go to the course, you can take those cases with you and say, you know what, I made these mistakes, Albert, how can I prevent it from happening next time? And that way you're gaining as much information as you can from that speaker, and making the best out of that opportunity. What do you think?
Yeah, I agree. I mean, you have a better understanding of what they're actually teaching and you soak it in more.
Yeah. So day 2, we'll keep you guys updated.
Hey guys, I've got Alistair here, who's got a private practice in Milton Keynes called Rocker. It looks amazing. We have a question for you today. What courses do you like for your associates to go on?
For me, Invisalign's a big one. Some kind of bonding course like Simplifi. I think as students in university, we don't have enough hands-on experience. So I want my associates to be competent in that.
Yeah, fair enough. Thank you very much.
Thank you. Alright guys, so we're with Dr. Venci and we're asking the question, what are the top 3 course topics that you would recommend to young dentists or someone starting out?
For me, the most important thing is occlusion. So occlusions are definitely our foundation. Once we got our foundation sorted, then we're going to look at doing something more aesthetic, so composite bonding or veneers.
Yeah.
And then we want to make ourselves stand out, so implants.
Perfect, thank you.
That's some great advice.
They're all so much taller than me, man. Thank you, Venci.
Thank you.
Hey guys, I've got Matt here. Matt, we just wanted to ask you why you chose to come onto a composite bonding course.
So for me personally, I think the reason I booked onto a composite course was just to kind of get an overall appreciation for like smile design and a bit more insight into like how you go about doing that, the stages, and just more of an appreciation for aesthetic dentistry.
Yeah, fair enough. Okay, and then just as a little follow-up, what types of courses, or if you had to give me 3 courses, what would they be? Types of courses, not specific.
Yeah, sure. So I'd probably go for like some form of like composite course, just because as I said, it incorporates smile design. I'd then second that with an orthodontic course, just so you can implement that smile design in terms of like moving the teeth into an ideal position. And then just to tie it all together, I'd probably go for like an occlusion course, just so you get longevity in your work.
Occlusion's a common theme. You're seeing something here. Yeah, occlusion courses they just level up your dentistry. They take it to a new level. You see teeth in a different way. Yeah, you just go on a good occlusion course. That's a good recommendation.
End of our 2-day journey with Albert. It's been a phenomenal course. Like, I know we always say this, but like genuinely, Albert's been a phenomenal teacher. We've learned so much. With this vlog, we were kind of just trying to help you guys out with the courses and things like that. You know, we're not trying to get into too many tips and things, because it can sometimes get boring to just watch us do hands-on. So we hope you found that one useful.
Yeah, it was really nice learning from Dr. Albert. Honestly, the things that he covered it in such a way that it was very simplified. It's literally in the name of the course, simplified.
What I liked as well was I really felt confident going back to actually do like a proper 3-3 or like a 5-5 bonding case. Like rather than just like learning how to do a central or something like that. And that's the confidence that he gives you to be able to tackle 3-3 and 5-5 cases.
And make sure you guys check out the simplified course. We're going to put a link in the description.
Thank you guys for watching this video. Again, we hope you found it useful. If you did, share it with your friends, like, comment and subscribe, and we'll see you in the next one.
Take care guys, bye.